Welcome everyone to today's session, The Silent Signals Understanding Men's Health Before It's Too Late. On the occasion of Men's Health Week, we have Dr. Tarun Javali, consultant urologist and andrologist and laparoscopic surgeon with us for today's discussion. And this session is in collaboration with Sagar Chandramma Hospitals. Let me introduce Dr. Tarun sir to all of you. He is a professor and consultant urologist, Ramaya Medical College and Memorial Hospital, AIMS New Delhi trained urologist and renal transplant specialist, former president Bangalore Urological Society, international fellowships USA and Japan, gold medalist and award winning researcher with 50 plus publications and 5 book chapters, healthcare leader, mentor, and men's health advocate. Welcome, sir, for this session.
Thank you. Thank you for the invitation.
Yeah. Now, let me quickly walk you and introduce about IIHMR to all of you. About IIHMR Bangalore, it's an exclusive academic and research organization in healthcare management where we take care of healthcare management education, research and consultancy, and training programs in health and related areas. Our key verticals are under academics, PGDM Hospital and Health, PGDM AI and DS in Healthcare, Fellow Program in Management and Pharmaceutical Management. We also have research and consultancy, which takes care of evaluation, formative, implementation research, social assessment, hospital quality and accreditations. Under training departments, we take care of MDPs, FDPs and EDPs, certificate programs, as well as professional practice series. We have another division known as Center for Advancing Digital Health, which we call as ADMIRE, where Skilling Hub, Research and Development Hub, DigiHealth Data and AI Lab, and Incubation Hub are present. Let's talk about briefly about committed to enhancing healthcare standards through improved management. What are our key milestones in our journey so far? In 2004, establishment of South Campus of IIHMR Bangalore offering health and hospital management. In 2010, AICTE approval PGDHM Health and Hospital Management with 60 students per year. In 2015, NABET accreditation, first South Indian academic institution. 2017, new specialization, health information technology. In 2018, we received MBA equivalence by Association of Indian Universities, AIU and NBA accreditation. In 2020, new specialization, pharmaceutical management, 120 students per year, change from PGDHM to PGDM. In 2022, new vertical, Center for Advancing in Digital Health came into the picture. In 2023, new program, fellowship program in management with 10 scholars per year started. In 2024, new program PGDM AI and DS in healthcare with 30 students per year started. In 2025, we received NAC accreditation with grade A, and 2026, which is this year, we have started a new program of PGDM pharmaceutical management with 30 students per year. Now, let me brief you about our academic program at a glance. Our academic programs are PGDM, Hospital and Health Specialization. These are the specializations available: hospital management, health IT management, and pharmaceutical management. PGDM, AI and DS in healthcare. Fellow program in management, which is equivalent to PhD, and PGDM in pharmaceutical management. Curriculum, customized curriculum based on industry requirement, the right mix of industry academia interface. Coming to placements, a dedicated department for internship and placement, 360-degree career guidance, 90 plus organization for placement and excellent placement record. Coming to awards and recognition in brief, we have received prestigious AAA plus rating in India's Best B School ranking in 2026 by Careers 360, 10th B School in Bangalore, Outlook 2025, Mirchi Business Class Awards 2024 for excellence in hospital management and digital healthcare innovation, Gold Band grade in Outbased Education Ranking 2023, World Institutional Ranking 2023, 7th B School in Bangalore, with Outlook B School ranking 2022 and Outstanding Academic Institute for the year 2022 Times Award. These are some glimpses of our hands-on experience in real setting to prepare our student to manage programs in diverse and dynamic environments. Research at IIHMR Bangalore has thematic focus, which includes health system strengthening, nutrition, RMNCH, urban, rural, and tribal health, and social behavioral change communication. And our expertise include monitoring and evaluation, large-scale survey, and implementation research. Center for Learning and Development is another branch which takes care of industry relevant training, targeted skill enhancement, addressing the immediate practical demands of healthcare industry, capacity building programs, which include structural and operational strengthening programs designed for organizational effectiveness, leadership initiative, developing tracks specifically tailored to the evolving needs of healthcare stakeholders. Center for Learning and Development at IIHMRB main focuses are public health research, healthcare quality, digital health, pharmaceutical management, health insurance, and health and nutrition. A fragmented system requires integrated leaders, and our focus remains represent the critical intersections between clinical practice meets systematic management. Coming to NABH and quality consultancy services, IHMR Bangalore is the first educational institute in India to be accredited by NABET as Hospital and Healthcare Consult Organization for NABH standards, recognized as empaneled agency by National Health Authority, that is NHA, to improve the quality and standards of healthcare facilities in Karnataka. Our program offerings are accreditation program, accreditation maintenance, quality and patient safety program. IHMRB, sorry, IHMRB is recognized and presented Gunavatta Pathashala Championship by National Accreditation Board for Hospitals and Healthcare Providers, that is NABH, a constituent board of the Quality Council of India. Coming to our next branch, which is Center for Advancing Digital Health, which takes care of these things. Research and Development Hub, which focuses on project related to public health informatics, clinical informatics, and consumer health informatics. Skilling Hub includes development of a digital health ready workforce through high value training programs, boot camps, and technology expertise. DigiHealth Data and AI Lab, a cutting edge lab supportive research, startup incubation, and testing of algorithms in digital health. Incubation Hub, dedicated to fostering innovation in digital health by supporting startups and helping them to move proof of concept to market ready products. Broadening our reach through strategic collaborations, which includes government institution, academic institutions, learning and development, health tech and medtech companies, and healthcare delivery. Now, coming to our intellectual capital of IHMR Bangalore, as we can see, the huge strength of associate and assistant professor, and mentors. Thank you, everyone. And thank you, sir, for listening to our presentation. I hand over the session to you. Kindly take it forward. Thank you so much.
Thank you.
Well, thank you so very much for that wonderful introduction. Good evening, everyone, and welcome to today's webinar, The Silent Signals, Understanding Men's Health Before It Is Too Late. We are honored to have Dr. Tarun with us today. Men's health is a topic that doesn't often get that attention that it deserves until a problem becomes impossible to ignore. Today's discussion is all about recognizing those early signs, breaking common myths, and understanding how men can take charge of their health before small concerns become major issues. And to everyone joining us, this is meant to be an interactive session. Please feel free to share your thoughts in the chat and keep your questions ready for the Q&A segment later on. Let's dive in. Dr. Javali, let's begin with Men's Health Week. Every year it carries an important message about awareness and prevention. As a clinician who works closely with men's health issues, what does this year's Men's Health Week message mean to you personally and professionally?
So, thank you, Dr. Varad. As we know, the Men's Health Week is generally celebrated around the time of the Father's Day, 1 week prior. And the themes are different according to the part of the world which we are coming from. So the theme of this year is Partners in Care for Better Lifespan Across the Lifespan. That means the theme this time highlights the critical role that families, caregivers, and committees play in supporting the long-term health outcomes for men. And it emphasizes the need for preventive screening, mental health support, and chronic disease management of men. So, as we know, men are conditioned to push through pain, they dismiss symptoms, and they avoid the doctor's office. And this proves to be very costly because men die 5 years earlier than women on an average, and they're more likely to develop chronic preventable diseases, less likely to seek mental or physical health support, and there are higher rates of suicide and undiagnosed depression. So, in every stage of life in men, there is an issue which prevents them from seeking help. In the 20s, they may feel I am indestructible. So, youthful energy masks early metabolic sickness, and bad habits are formed in the early 20s. In the 30s, they are held up with work and family life, too busy, and the career and family demands push health to the bottom of the priority list. And once they reach the 40s and 50s, many may feel that it is too late to start. This is a time when what we call as fatalism sets in, but this is precisely when interventions matters most. An important point to remember is that there is no age at which it is too late to start caring for your health. And early action at any stage yields measurable benefits within months. Now, especially for management consultants or IT professionals or those who spend a lot of time in front of the desktops, laptops, in the chair, because of the irregular meal patterns, reliance on processed food, long duration of sitting, chronic sleep debt, and all this causes elevated cortisol from sustained cognitive and emotional stress. And this can silently erode the physical health over years. So a study in US showed that close to 7 million men had not gone for a health checkup in 10 years. And 40% avoid preventive care. And 72% of patients come with very late diagnosis. Now, I'm a urologist and an andrologist. So I will speak about the men's health and the urological conditions which we need to be aware and what we need to do to keep our health in check and how to seek early preventive health care. Dr. Bharat, you can ask the questions. I will just move through the slides. You had, I think, some questions.
Yes, yes. Yes, sir, definitely.
Yeah. So I'll
Well,
just
the
slides in the background so that the audience can have a visual this thing also. So you can.
representative of this. Perfect, perfect. Yes, definitely, definitely, sir. Well, whatever you said actually is such an important perspective. I think many people do assume that men's health is only about fitness or physical strength, but the message is often much more broader than that, as you rightly said.
Yeah.
I would on the same page, I would like to ask you one more very important question as to why is it important to have an open conversation about men's health, and what are some of the barriers that prevent men from having these conversations in the first place?
Yeah. So as I told you, many men are conditioned to appear strong and self-reliant, and they uh, don't like asking for help. So men frequently delay seeking healthcare due to stigma, fear, time constraints, or the perception that symptoms are only minor. So open discussions improve the awareness. They can encourage early diagnosis and they reduce long-term complications. So it's very important to have an open conversation, have regular preventive health checkups, so which you can take early steps before it becomes too late.
And how do we suggest that we break those barriers of
Yeah.
communication?
So there are certain silent signals which men should not ignore. One, persistent fatigue, reduced exercise tolerance, erectile dysfunction. I'll speak about this in detail. Loss of libido or sexual desire, unexplained weight changes, blood in the urine, testicular lumps, frequent nighttime urination, and mood changes. All of these should prompt medical evaluation. So, as a urologist and andrologist, the most common problem which I face, which we encounter in the OPD clinic, is men who have prostate issues. So, prostate is the gland which is below the bladder, which is important during the reproductive age group. With age, it can increase in size, it can compress the urethra, and it can lead to the following symptoms. One is the weak stream, frequent urination, incomplete bladder emptying, and urgency and dribbling of urine. Now, this generally occurs after the age of 50, 55, but even some younger men can also develop little prostate enlargement early, especially if they have any family history. What's very important to understand is both benign enlargement of prostate as well as prostate cancer can have similar symptoms. And in some early stages of prostate cancer, there can be no symptoms at all. So the recommendation is every man after the age of 45, 50 years should get a urology consultation, and especially you have to get a blood test called the prostate specific antigen. It is a blood test which is a marker of prostate cancer. If it is below the established limits, then it means the issue is the benign enlargement of prostate. If the PSA is high, then it may warrant further investigations in the form of an MRI of the prostate or a prostate biopsy to see what we are dealing with, because treatment of benign enlargement of prostate is completely different. Treatment of prostate cancer is totally different. Benign enlargement of prostate we generally treat with medications, and if patients who are not responding to medications, we do laser surgery. Now there are various, the gold standard is what is called as the transurethral resection of the prostate. This is done through the urinary passage with the help of the instrument called resectoscope, and the prostate, the obstructing part of the prostate gland is removed and sent for the biopsy. But now there are newer techniques. One is the laser, and further techniques called MIST, which stands for minimally invasive surgical therapy of the prostate, where no tissue is resected. It is a 15 minutes day care procedure, specially suited for younger men who do not want to start on medications, who are sexually active. The advantage of this technique is that it preserves the ejaculation, and recovery is very quick, and patients can be discharged on the same day. It's like a daycare procedure. Now, other techniques are also available, like the water vapor therapy and a green light laser and aqua ablation. I will not go into the details of this because it's beyond the talk. But what is important what message I want to give is, if you are facing any urinary issues, slow flow, frequent urination, burning pain, you're not emptying the bladder completely. That means, especially at the age of 40, 45, it means you're having either a prostate enlargement, or sometimes they could also have a stricture in the urine pipe. So you need to get evaluated by a urologist and get certain basic tests like a uroflowmetry, which detects the speed of the urination. And then based on the symptoms, the degree of severity, you can either be started on medicines or you can be offered surgery. Dr. Bharat, anything?
Beautifully explained. Beautifully explained, sir.
Yeah.
Well, to be very honest, you have already explained whatever questions I had in mind already, because it is very interesting how our bodies often give us a clue long before a serious condition actually develops. So I have a mix of two questions, one for the younger audience, one for the older one.
Yes.
How do we differentiate the sign and symptoms in the younger population, which might eventually turn into something serious? And for the older gentlemen who are viewing this webinar today, how do we differentiate that particular thing and decide that it is the right time to go and see the doctor now? How do we decide that it is the right time to go and get ourselves checked?
Yeah,
Because
you
as
mean
you
with
said,
the
it is good to
prostate?
go.
You mean with
Please,
respect
please,
to the
please,
prostate or with respect to in general?
please shed a light on both of them, sir.
Yeah. So, as I told you, there are certain symptoms which we should not ignore.
Mhm.
The myth that cancers occur only in the elderly is false. Nowadays, with lifestyle changes, smoking, sedentary habits, hypertension, obesity, we are seeing a lot of malignancies even in the younger age group. I recently had a bank employee, 32 years of age, no medical issues, not a smoker, very healthy lifestyle, just went for a routine annual health checkup, got an ultrasound scan done, which showed a 3 into 4 centimeters lump in the kidney, a tumor, kidney cancer. So for him, we did what is called as a robotic partial nephrectomy. Because it was picked up at an early stage, we could remove only the tumor and preserve the rest of the kidney. So this highlights the importance of screening, because without screening, supposing this patient had not undergone an ultrasound scan, he would have presented 2 years later with symptoms like blood in the urine, pain, weight loss, and that time it would probably be too late. The cancer could have spread to the rest of the body, or it have grown to such a size that we have to remove the entire kidney itself. So the the take-home point is here is don't wait for symptoms. It's very important, especially if there's a family history of any malignancies in the family or any issues, to have an earlier consultation so that we can detect all these issues at an earlier stage. For the younger men, now because of lifestyle changes, we are seeing a lot of patients with erectile dysfunction. This could be, the risk factors could be vascular, like hypertension, atherosclerosis, diabetes, obesity, hormonal, sometimes psychological, lifestyle, etc. What's important is when we get a patient who complains of erection issues, it's important to understand that the factors which cause loss of erection are the same which cause cardiovascular diseases. So the plaque buildup because of atherosclerosis, diabetes, BP, it affects the blood vessels of the penis much earlier than it affects the heart. So if a man in 40, 45 comes with erection problem, definitely within the next 5 years, he's going to develop a cardiovascular issue. So all men who come to me with erection problems, along with the routine checkup, we also get a cardiovascular profiling done, because they are at a high risk. And if we don't intervene early and start them on lifestyle changes, stress management, sleep, stop smoking, alcohol, and reverse the high blood sugar levels, definitely he's going to end up in either a coronary event or a stroke. So the erectile dysfunction gives us an opportunity to screen these patients for the cardiovascular issues also.
Perfect.
Now,
And what are your opinions on the usage of some pills which people take, which patients take to
yeah.
rid themselves
Oh,
of this erectile dysfunction, that is
yes.
sildenafil or tadalafil,
Very, very,
Viagra in
yes.
layman terms?
Very good question. Most important is do not take over the counter. Okay. Always consult a urologist. And if you have some cardiac issues, you should also consult a cardiologist before starting these medications, because these are good medications, no doubt. they can improve the erection and allow men to have intercourse, but they can also have some side effects. And if you're having any major cardiac issues, as I told you, men with erectile dysfunction can also have cardiac problems. If you're having any undiagnosed cardiac problems, and if you take these medications, sometimes the side effects can be catastrophic. So before taking these medications, first get yourself evaluated. First step is always, before starting medications, lifestyle modification. Stop smoking, limit alcohol, improve your sleep, go for a walk every day, improve your fitness, reduce stress, concentrate on diet, bring down your sugar levels and blood pressure. With all these lifestyle modifications, if the erection problems is still persisting, then we go for these medications like sildenafil and others. Now, many of the men, the medications work. In some, the medications will not work. And then we go to the second line treatment, which consists of uh, injections into the penis, but these are sometimes painful. Men are not very hesitant to take it. And the last step would be what we do, penile implant. These are not for all. These are only for men who have tried all other aspects like lifestyle modification, medications, injections, hormonal therapy, and have failed. In these,
மென்ஸ் ஹெல்த்தை பத்தி பேசிட்டு இருக்காங்கப்பா. ப்ராஸ்டேட் இது சொல்லிட்டு இருக்காங்க. ஏதாவது சொல்லிட்டு இருக்காங்க.
hello, yeah. So for men who have failed all,
Ladies and gentlemen, I urge you to type in your questions in the chat box. We will visit some of your questions very shortly and we will answer them in the Q&A session.
yeah. So
Meanwhile, we would be very thankful if you could keep your questions till the end of the session, please. Thank you. Dr. Tarun, please continue.
yeah. So I was telling you the treatment of men with erectile dysfunction. First is the medications, lifestyle modification, and the men who fail all these, we then offer them penile implant, which is a very satisfactory procedure for a majority of these men. These are silicone implants which we put into the penis through a small surgery, and there's a button. So whenever the man wants to have an erection and have intercourse, he presses the button and performs it, and then he can again deflate the device. So this is the last step. The other aspect, Dr. Varat, before I go into this one, you have any further questions?
Yes, this one would be for our audience, sir. A quick reflection for everyone who is joining us. Has today's discussion already made you think differently about the symptoms or health concerns which you have previously ignored? And I would like to ask you a quick question in the chat, all of you. Please don't feel shy. Whatever questions you have, every question we would try very hard to answer all of them. And I would like to ask you this question personally. What do you think is the biggest reason men avoid discussing health concerns? Is it A, lack of time, B, fear of the diagnosis, or C, is it embarrassment, or D, I'll deal with this later? What do you think is your response? We'll revisit some of your responses very shortly. Meanwhile, feel free to type in any questions which you have and do give the answer to this question as well. Yes, Dr. Tarun.
Yeah, so being a urologist and andrologist, I'm dealing with those men's health issues which patients commonly come to me. So I'm not dealing with things like myocardial infarction or stroke or those sort of things. I'm dealing with one, prostate issues, which is very common, urinary problems, sexual problems, and thirdly, something which is often overlooked is the male infertility. Now we know that couples are getting married at a later age nowadays, and when the couple fails to conceive, many times the entire onus is on the female partner. And when it's important to understand that the male factors contribute to approximately 50% of all infertility cases. That means men contribute 50% and women contribute another 50%. So it's also important for the man to get evaluated because of lifestyle, because of the chronic heat exposure, smoking, we are seeing the reduction in the sperm quality. And many men have very reduced sperm quantity as well as quality. So it's very important to meet the andrologist to get the semen analysis done and see what can be what medications can be taken to improve the sperm quality. Other aspect is with age, the testosterone levels keep falling. And it's very important hormone because it governs the muscle mass, bone density, mood, cognitive function, energy levels, libido, and metabolic rate. So, signs of low testosterone. What are the signs of low testosterone? Persistent fatigue, reduced muscle mass, increased body fat, low mood, irritability, decreased sexual desire and performance, and poor sleep quality and recovery. So, if you're facing all of these, along with the routine blood tests like getting your sugars, cholesterol, it's also important, especially after the age of 30, 40, to get your testosterone levels checked. So if the testosterone levels are low and you're facing all these issues, we can do the testosterone replacement. But before testosterone replacement, again, lifestyle modification, consume more of antioxidants, lean meat, fish, eggs, dry fruits. All this helps in improving the testosterone levels. Of course, good sleep and exposure to sunlight. If all this fails, then the next step is the testosterone replacement. But one important point is, in men who want to father a child, we can't give direct testosterone because it suppresses the sperm production. Only men who have completed the family, who are facing any issues because of the low testosterone, only in these men we give supplementary testosterone. Dr. Varad?
Yes, sir. And what about some people who suffer, some men who suffer from the cases of gynecomastia,
Yes.
who majority of the times are unaware
Yeah.
of them having low levels of testosterone in the body?
Yes.
What are some
Yes. So the
suggestions which you would like to give to them as
Yes.
to how to tackle this issue, or are there some remedies which can be done to treat this at home, or is surgery a must?
So the most common cause is obesity. So what happens is, in obese men, testosterone gets converted to estradiol, the female hormone, which can cause gynecomastia. So first is the lifestyle, exercise, aerobics to decrease the body weight. And even with that, if it's not helping, the next resort is to do the surgery and remove the excess fat. Sometimes gynecomastia can also be because of some congenital problems or if the testis, it's called primary testicular failure. If the testes are very small, they're not producing enough testosterone. So that could also be one of the causes for gynecomastia. So you'll have to get yourself checked, get the andrologist or urologist to check the testicular size, check the hormone, and see what is the actual cause of gynecomastia before we start the treatment.
Beautiful. And I see multiple options pouring in the tech chat box. As we have asked the question to our audience, what do you think is the biggest reason men avoid discussing health concerns? And the options were A, lack of time, B is fear of diagnosis, C is embarrassment, and D is I'll deal with this later. So majority of the people have responded with B and C, that is fear of diagnosis and embarrassment. That is one of the very core issues which we often see in Indian men, sir. Many men are afraid of going to the doctor just because they don't want to talk about this particular thing, which is wrong with them, pertaining to their sexual health, pertaining to their hormonal issues, because of the fear of diagnosis and, in general, an embarrassment. How do we deal with this?
Yes,
How do
so
we tackle this issue?
that's where the theme of this year's Men's Health Week comes into play. To repeat, partners in care. That means for better lifespans across the lifespan. So partners means having a good support system, family support, colleagues, workplace. So if there is a good support system, both at the workplace and at the family level, men will be more eager to come out and ask for help. And also through webinars like this, we can make men more aware that it is okay to ask for help, avoid the stigma, come out, meet your doctor, get regular annual wellness examinations, because we never know what underlying issue there is. So it's always good to seek help.
Truly. And I think we are covering a lot of ground today. And I'm sure our audience has questions. I believe, Doctor, I would like to bring in a question from our audience because I think it connects perfectly with what we have just discussed.
Sure, sure.
There's one gentleman who's asking, is testosterone test required even above the age of 70 years?
Generally, if the person is facing signs of low testosterone, like as I told you, decreased muscle mass, we can always do it even after the age of 70 years. And if it's extremely low, we can always supplement with testosterone. So there is no problem. But one important point is, before we start testosterone, it is always therapy. It's always important to rule out prostate cancer, because testosterone can cause flare-up of undiagnosed prostate cancer. So before starting testosterone therapy, especially in men above the age of 60 years, get a digital rectal examination by a urologist. That means the urologist will examine the prostate gland and will get a PSA level done. If the prostate examination is normal and the PSA is normal, if the testosterone is low and the man is facing side effects because of the low testosterone, we can start the testosterone therapy. So most important, before starting testosterone, prostate cancer has to be ruled out, especially in men above the age of 60 years.
Wonderful. Mr. Krishna, I hope you have received your answer, which you were looking for. Now, sir, there's one more question which I would like to highlight. There's one gentleman who says, I had a PSA of 7.740 in April 2025. Asked by my urologist to go for bypass. I didn't. I am having Tosalin D, tamoxifen hydrochloride, 0.4 mg, dutasteride 0.5 mg since November 2025. Latest a month ago, my PSA was 5.6. My urination is improved but takes a lot of time to clear. Nighttime urination is 2 to 3 times. My prostate weight is 25 to 30 grams on various ultrasound checkups. Any comments on this one, sir?
Yes, very good question. First of all,
Pretty detailed question, sir.
Yes. I think yeah. So one important point I need to stress is, we get PSA done only in men who have more than 10 years of life expectancy. Supposing a man is 75 years, bedridden, has undergone a coronary bypass, as suffering from some other chronic diseases, we generally don't get PSA done. Now, in this gentleman, he had a PSA of 7.7. He has not given his age and his fitness level. That is also very important. Now, all high PSA does not mean prostate cancer. Sometimes prostatic inflammation can also cause high PSA. So generally, we repeat the PSA. Now, this gentleman is taking a combination of tamsulosin and dutasteride. The dutasteride component, what it will do is, it will falsely bring down the PSA. Supposing a patient has taken this combination for more than 6 months, the exact PSA will be double the calculated value. So his PSA of 5.6 will be actually double that. That means 11.2. Okay. So in patients with elevated PSA, we generally do another screening test called multiparametric MRI, which gives a scoring system regarding the possibility of him having a cancer or not. So it is scored from 1 to 5. If he gets a score of 1 and 2, we don't do a biopsy. If he gets a score of 3, 4, and 5, then he will have to get a biopsy done. So he has messaged that he's 78 and health is perfect. So in him, I would suggest first to do a screening test, which is called a MPMRI. Based on that, we will take a decision whether to biopsy or not. If the MPMRI gives a value of 1 and 2, there's no need for biopsy. He can go ahead with his medications. If the report comes as 3, 4, and 5, he will need to undergo a prostate biopsy.
Wonderfully explained, sir. And sir, when people hear the term men's health, they often think about muscles, exercise, or weight management in general. And now, since people are getting educated, getting to know about their own personal health, particularly men, about their hormonal health as well. But I believe health goes far beyond that. How does mental health, stress, and emotional well being influence overall men's health as well? Please shed some light on that as well, sir.
Yeah, so mental health is very important. Poor mood, irritability could also be signs of low testosterone. So the one important thing is to search for reversible factors, check for vitamin D, B12 levels, and if everything else is okay, it's very important to seek a psychologist help, because poor mental health can have adverse effect on your sleep. It can increase the stress levels, increase cortisol levels, and all that has a vicious circle and can cause increase in inflammation, plaque buildup in the vessels. So it's a vicious cycle. And most important thing to improve the mental health, one of course is the exercise, diet, sleep. But if it's not improving, if there's persistent low mood, it's always best to consult a psychiatrist. Bharat?
Wonderful, sir. Beautifully explained. Yes, thank you. And when discussing fertility, I believe misinformation is everywhere. What are some common myths about male fertility that you frequently encounter in clinical practice? And what are some ways at home, some treatments which can be done for men to get themselves rid of the erectile dysfunction or the lack of energy or the low enthusiasm which many male men above the age of 30 often tend to go under?
So very important is one, smoking. Smoking is bad for the heart. It's bad for the penis. It's bad for the erection and libido. So smoking includes even vaping. So that has to be completely stopped. Reduce the alcohol intake. Improve the sleep and exercise. These are very important things. Along with that, healthy diet. Avoid processed food or packaged foods which are high in salt content. Go for fresh fruits, vegetables, dry fruits. And one more important thing is, many men go to gyms and the gym trainer asks them to take in some artificial proteins. That's also sometimes can be dangerous. So go for natural proteins rather than packaged proteins. Natural proteins like lean meat, fish, or sprouts, tofu, paneer. So go for natural sources of protein and not packaged protein.
Yes, sir, definitely. I believe there's one more question which needs to be answered. Uh, Mr. Omkar asks how much zinc is required for male fertility. Can we get it by dietary sources or are there supplements necessary?
Generally, if a person has low sperm count with deficient uh, morphology of the sperm or the motility of the sperm, we generally put these men on 3 months of supplements. Uh, so these are called antioxidants. It is not just zinc, it's a combination of antioxidants like selenium, magnesium, uh, L-carnitine, coenzyme Q, vitamin C. All these are very important for spermatogenesis, that is the formation of the production of the sperms. So it's not just zinc separately, but as a combination with other antioxidants. Generally, zinc requirement is around 10 to 15 milligram per day. And good dietary sources are generally legumes and seafood. All seafood, they are good in zinc. Also meat, poultry, and nuts and seeds. These are the foods which are generally rich in zinc. But again, as I told you, we don't give zinc alone. It's usually as a combination with the other antioxidants.
Definitely, sir. And one question for the gym rats, let's
Yeah,
call them.
yeah,
So there are many people, often quite often friends of mine as well. Me being in the medical medicine field as well, I get asked this question a lot, but I believe you are the best person to answer this question for all the gym going audience. So this question often arises that their trainer, often in the schemes of making a little bit more money, often suggests them to take some steroids to see good gains very quickly, right?
yes.
So
So,
many of the younger generation, many
so
of the men,
yes,
please.
absolutely. It is to be condemned.
Hmm.
Steroids should not at all be taken. It can
Right.
have long-lasting effects. I've seen many men who are into gymming who have taken steroids, and also some of these gym instructors give them testosterone over the counter that will adversely affect the testicular health. Many of these men come present at the 30s and 40s with infertility,
Hmm.
and artificial proteins. If you can get, see, not all artificial proteins are bad, but we don't know how these proteins will interact uh, with somebody, because in 8 out of 10 times there may be no issues, but in those couple of 2 out of 10, it can adversely interact with the kidney, leading to what is called as interstitial nephritis. So we've had patients landing up in renal failure. So before taking any artificial proteins, better to consult the urologist, I mean the nephrologist. But always natural sources of proteins are better. So there was this chat box, chat, I think somebody has asked, Tejaswini has asked about the powder supplements. So always go for the natural sources of proteins. And if you want to take any additional supplements, always consult a nephrologist or a medicine specialist. And regarding the steroids, it's an absolute no. There is no quick fix. Steroids and supervised testosterone can really create havoc.
Absolutely perfect, sir. When it is rightly said, it is often said that prevention is easier than treatment, and certainly it is less expensive too. Well, coming back to the next question which we have, uh, what are some routine health screenings which men should prioritize at different stages of life, at different age groups?
So I will speak in general. What are the screenings required? Uh, One, of course, the blood pressure and sugar, very important. Cholesterol, cardiovascular risk assessment, especially after the age of 45, you can get a treadmill test, an ECG, and echo. For men with family history of cancer, very important to check a cancer panel for colorectal, getting a stool occult blood test, and getting a PSA above the age of 45 for prostate cancer, an ultrasound of the abdomen and pelvis to check for the kidneys and other intra-abdominal organs. That's also very important. And the hormonal panel, especially for men younger age for fertility, we get the semen analysis and the testosterone levels. So all these are very important. Dr. Bharat?
Yes, definitely, sir. That's extremely useful information. And there's one question pertaining to the current topic which we are actually discussing. There's one gentleman who says, is it normal to feel low as well as extra active in doing work on several days of the month? If it is not okay, how to improve it naturally, physically, as well as mentally? I believe this is an extremely important and a question which many men would relate to, because we often see in advertisements on the TV as well. There are multiple ads which showcase ginseng as a multivitamin tablet or some supplements which do help in enhancing that activity level in your body. So, do we men also have a hormonal cycle in our system, a monthly hormonal system where we feel extremely active and then low in energy in certain specific periods of months or days of the month? And if that is so, how do we deal with the extra active ones and the days when we feel very low? Please, sir.
Uh, there is no cycle as such, but very important is if the sleep is deprived, that is the most important cause of feeling low. If the sleep is not of good quality, it's not just the number of hours of sleep, it's the quality of the sleep. If that is not good, uh, it can definitely affect the activity level. So one important cause of poor sleep quality is which is often undiagnosed, is a condition called obstructive sleep apnea, especially in obese men with a lot of central obesity or thick neck. There could be periods of sleep when there is low blood flow to the brain. It's called hypoxia, either because of the tongue falls back or because of various issues, especially seen in men who snore a lot. So if you can ask a partner, a wife, if you have a lot of snoring, and that is an indicator that you have obstructive sleep apnea, you can have to visit an ENT specialist or a general physician to get it checked. Because if the sleep quality is poor, it's one of the most important causes of low activity, physical activity, and feeling of low mood. So the sleep quality is very important.
Wonderful, sir. One last question we would take, then we would skip to the next segment of our webinar. Does taking caffeine daily affect men's health in terms of testosterone?
Uh, Coffee once a day is okay. Black coffee also is okay. But excess coffee can affect the sleep. And that can, as I told you, indirectly affect the testosterone. Low sleep can lead to low testosterone. So avoid caffeine in the evening and in the night. And one more reason to avoid coffee in the evening, especially in the elderly men, is that it's a bladder irritant. And so what happens is if they take coffee in the evening or in the night, they can suffer from frequent urination in the night. They have to get up multiple times to pass urine, called nocturia, because it's a bladder irritant. So having coffee is okay, especially in the morning times, but avoid it in the evening and night. Dr. Bharat,
Definitely, sir.
time I think.
Definitely. Yes, yes, yes. I am aware of this one, and I believe we have covered a lot of ground today. And I hope the people who have been sticking with us till now have gotten a lot of information, quite a useful information, in fact. Now, without taking much time, let's jump onto the slightly fun, shorter segment of the webinar before we conclude, which would be a rapid fire round, myth or a fact, which would also help in the audience of getting bullet points of whatever was spoken in this webinar. All right, doctor, are you ready? I'll
Yes.
read out a statement and you just tell it whether it is a myth or a fact. And if you want, just give us a brief explanation. Ready?
Yeah, sure. Shoot.
All right, perfect. Yes. Statement one: men only need health checkups when they feel sick.
It's a myth.
Perfect. Prostate problems occur only in older men.
It's a myth. Sometimes
Erectile.
prostate issues can start earlier, especially if there's a family history.
Mhm.
But what is important is certain other diseases, especially of the urethra, like called urethral stricture, can produce symptoms similar to prostate, especially in younger men. So they can have a condition called urethral stricture, which can cause poor flow, frequent urination. Sometimes there can be stones in the bladder, sometimes urinary infection. All these can have the same symptoms as prostate enlargement and seen in younger men. So it is important, if you have any urinary issues, to get yourself checked.
That's a very practical takeaway, sir, and quite a useful information in general. Well, coming to the next one. Mental health affects physical health.
Yes, of course.
Infertility is always a woman's issue.
Myth. As I
Myth.
told, men contribute 50%.
Very true. Frequent urination at night should be ignored as part of aging.
No, it is should not be ignored. It could be an early sign of prostate enlargement. Increased urination in the night could also mean you have high blood sugar levels. So it could also mean that your sleep quality is poor. So there are various causes for increased urination in the night, and it should not be ignored.
Beautiful. Well, ladies and gentlemen, I think we have gathered quite a lot of golden nuggets of information today. We've gathered quite a lot of useful information today. And doctor, before we conclude, I'd like to leave our audience one final single thought. If there is one single silent signal you wish men would stop ignoring, if there is one silent signal you wish men would stop ignoring, what would it be and why?
You're asking me?
Yes, sir.
Yeah.
Just one single question and then we would end it.
Yeah.
If there is one silent signal you wish men would stop ignoring, what would it be and why?
Poor sleep quality.
Wonderfully.
Most important.
Wonderful, yes.
It could suggest psychological issues. It could suggest organic issues. It could be because of increased frequency of urination in the night. It could be because of, as I told you, obstructive sleep apnea. So there are various causes for poor sleep. So this is one condition. Sleep is of utmost importance, and poor quality sleep can have a negative downstream effect, increases cortisol, increases stress, and leads to various cardiovascular issues and mental and sexual issues. So sleep quality is one of the most important things, and it should not be ignored.
Thank you so much, doctor. Thank you so much. Well, today's discussion reminded us that men's health isn't just about avoiding issues and illnesses. It's about paying attention, speaking up, and seeking help early, and making prevention a priority. Well, to everyone who joined us today, thank you so very much for your participation and engagement. Remember, the strongest thing a person can do for their health is not to ignore a warning sign. Stay informed, stay proactive, and take care of yourselves and the people you care about. Thank you, everyone. Thank you once again, Doctor. And all of you have a wonderful day. Thank you so very much for joining. Thank you.
Thank you.